My name is Audrey, and today I'm going to talk about Turner syndrome and the effect that it has on little girls and women that have it. According to AboutHealth.com, Turner syndrome is said to be the cause of about 15% of miscarriages, and about 99% of babies that have the syndrome are miscarried or are stillborn. All people are born with a set of chromosomes that determine whether they will be male or female. Boys are born with an X and Y chromosome, and females are born with two X chromosomes. I feel like I'm qualified to talk about Turner syndrome because my stepdaughter has Turner's. Today my purpose is to inform my audience on Turner syndrome and the effect that it has on little girls and women that have it. Many people have never heard of Turner syndrome, so in this speech I will be talking about what Turner syndrome is, the side effects of having Turner syndrome, and how girls, including my stepdaughter, live with Turner syndrome. Turner syndrome is a chromosome disorder which a female is born with only one X chromosome, or is missing part or parts of the pairing X. According to Wikipedia, Turner syndrome is not usually inherited from a person's parents. Turner syndrome is a chromosomal abnormality. Most people are born with 46 chromosomes, but girls that are born with Turner syndrome only have 45 chromosomes. Turner syndrome is named after an endocrinologist named Henry Turner. The first report of a female having Turner syndrome was reported in London in 1959. I've explained what Turner syndrome is, but I'm sure you would like to know the signs, symptoms, and how the syndrome is detected. Next, I'm going to share with you some signs, symptoms, and characteristics of Turner syndrome, along with some treatments that will help. Girls with Turner syndrome can have a variety of different signs of this syndrome. These symptoms include a web-like neck, a receding or small lower jaw, high or narrow roof of mouth, low set ears, broad chest, short fingers and toes, fingernails and toenails that turn upward and are narrow, and a delayed growth. If some of the obvious signs are not present, usually parents will not notice anything until their little girl's growth stops or stalls out. All these signs and characteristics of Turner syndrome are not always there, and when there is not any that point to this syndrome, the endocrinologist will have to run special tests to determine if the little girl has Turner's. Most women with Turner syndrome will not be able to conceive a child unless they go through fertility treatments. There are also many complications that come along with Turner syndrome, like heart problems, diabetes, high blood pressure, hearing loss, kidney problems, immune disorders, dental and vision problems, reproductively sterile, and an absence of a menstrual cycle. To conclude, I would like to tell you how girls like my stepdaughter live with this syndrome. My stepdaughter has regular appointments in Mobile to monitor her growth. She has to take human growth hormone shots every night to help her grow. She is petite, but she makes up for it in her personality. She also has to wear hormone patches to help aid her along in puberty. I guess you could say that without these treatments, she would have stayed small for a long time, because girls with this syndrome, their growth can stall dramatically. Hormones are usually something that is permanent because of the ovaries not functioning or a lack of them in general. Thankfully, my stepdaughter does not have any of these heart problems or health problems, or any serious complications as of now. She's had numerous problems with her ears and ear infections, and has lost some of her hearing in one of her ears. In conclusion, my purpose today was to inform my audience on Turner syndrome and the effect that it has on little girls that have it. Today I explained what Turner syndrome is, the side effects of having Turner syndrome, and how girls, including my stepdaughter, live with Turner syndrome. As I stated earlier, I feel qualified to speak about Turner syndrome because my stepdaughter has the syndrome. It is my hope that today I have been informative about Turner syndrome and have shared with the audience how even a slight change in a chromosome can change the way a person lives drastically compared to a person that does not have the same issue. It is not known how Turner syndrome happens, or as far as genetics go, meaning that it is not a trait that is passed down, nor does it matter the age of the mother during conception. Thank you for taking the time to listen to me today. Thank you.
Very good, little angel.
Okay, you can turn it off.